Bismillahirrahmanirrahim. Hello everybody. So a 25-year-old premi-gravida woman at 36-week gestation is brought to the emergency department with constant excruciating abdominal pain and sudden vaginal bleeding for the past 3 hours. The patient is Rh negative and received Rhd immunoglobulin at 28 weeks of gestation. Group B streptococcal culture were collected at her prenatal care visit last week, during which her cervix was examined and noted to be closed. The patient also has a history of nephrolithiasis, diagnosed during the pregnancy and managed expectantly. Blood pressure is 160 by 100 mm of Hg and pulse is 118 per minute. Physical examination show a firm, distended and tender uterus. Speculum examination show approximately 75 milliliter of red blood in the vagina. After evacuation of the blood, a moderate amount of blood is observed coming from an open cervical os. Fetal heart rate tracing show a baseline of 108 per minute and no variability. Which of the following is the most likely cause of this patient bleeding? Choice A, attachment of the placenta into the myometrium, full thickness disruption of the uterine wall, injury to fetal placental vessel, placental implantation over the cervix, premature placental separation. So first of all, this patient come to us at 36 weeks of gestation with excruciating abdominal pain. This is the first hint. The second hint is that this patient having nephrolithiasis and the most important one, she having hypertension. This is the most important hint in the question. With this hint, we can know the diagnosis of this question easily. Hypertension 160 by 100 mm of Hg. Second, the fourth hint is that on physical examination, she having firm, distended and tender uterus. So these, based on these four hints, the diagnosis of this question is first excruciating abdominal pain. This hint, the first number hint and the third number hint, and this question is the most important hint toward the diagnosis of this question. So first, excruciating abdominal pain. Second, nephrolithiasis. Third, hypertension. Four, firm, distended and tender uterus. So based on these four hints, the diagnosis of this question is abruptio placenta. Diagnosis of this question is abruptio placenta, and here the correct option is choice E, premature placental separation. So why abruptio placenta? Because abruptio placenta is the premature detachment of the placenta from the uterus. Risk factor for abruptio placenta include cocaine use and hypertension. As I explained to you, here the most important hint in this question toward the diagnosis is hypertension, because this patient has first excruciating abdominal pain and second, she having hypertension. Clinical presentation includes sudden onset vaginal bleeding, abdominal or back pain, high frequency, low intensity contraction with hypertonic and tender uterus. Come to the incorrect one. Choice A, attachment of the placenta into the myometrium, which is also called placenta accreta. Placenta accreta occur when the placental villi attach directly into the myometrium. Because the placenta cannot separate from the uterus after the fetus deliver, undiagnosed placenta accreta can present with massive bleeding during manual extraction of a retained placenta. Choice B, full thickness disruption of the uterine wall, which is also called uterine rupture. So uterine rupture is seen primarily in laboring patient with prior cesarean delivery or myomectomies. This patient has not had any uterine surgery, make this a less likely diagnosis. Choice C, injury to fetal blood vessel, and which is called vasa previa. In vasa previa, the fetal vessel traverse the internal cervical os and are vulnerable to injury during amniotomy, present with painless vaginal bleeding and fetal heart rate abnormalities. Choice D, placental implantation over the cervix, which is called placenta previa. Placenta previa is usually diagnosed during routine prenatal ultrasound and usually causes painless vaginal bleeding. So now come again to you. Now come again that why the choice E is a correct premature placenta separation, because this patient first this patient come to us at 36 week of gestation, in which she having constant excruciating abdominal pain, and second she having nephrolithiasis with hypertension of 160 by 100 mm of Ag. On physical examination, she having a firm, distended and tender uterus. So the diagnosis of this question is abruptio placenta. I will show a picture of abruptio placenta. They have the abruptio placenta look like. So this is the picture of the abruptio placenta. As we can see here, here is a hemorrhage, and with the placenta separate from the abdominal from the uterus wall. But here we can see that in this image the blood is accumulating here but not draining toward this side. So this is called concealed vaginal bleeding, because there is no bleeding from the vagina. And we can look to the other side, that this patient also having the abruptio placenta. The placenta is separated from the uterus, but she having she having the bleeding coming out of the vagina. So this is called exposed bleeding.